Okay, I think we're going to go ahead and get started. Christy will be joining us a little bit late. She's in another meeting at the moment. See, I don't know that we have anybody new today, do we? Well, actually, I know you're probably new to this meeting. You're not new to us, but we'll do a quick introduction if you'll tell us who you are, what agency you work with, and the population you serve. Um, I'll start. My name is Trista Lawrence, and I'm the coordination administrator. Oops, just pulled my headphones out here at UTA in the coordinated mobility department. John, let's have you go next.
All right, found the microphone. I'm the mobility manager down here in Utah County at United Way in Provo, and we work with the Utah Valley Rides program and the temporary trips program, and also advocate for transportation down here. I made sure that we got our VIA program actually serving the hospital and the senior center instead of cutting short by 3 blocks from supporting that.
All right, Gary. All right, maybe Gary, you're on mute if you're trying to talk. I also, if you can, unblock your cameras when you introduce yourself so we can put a face to the name, that would be appreciated. Sandra, let's go on to you.
Hi, I'm Sandra Curcio, and I'm the Executive Director at Ability First Utah Center for Independent Living. And we serve individuals with disabilities and in the Utah, Wasatch, and Juab and Sanpete County areas. And we provide transportation for anyone that participates in our program services. That's to and from our activities and to on demand.
Thank you. Alika.
Hi, I'm Olga Lindsay with UTA, and I'm the 5310 Grant Administrator in the Coordinated Mobility Department.
Phil?
Yes, I'm Phil Shumway with Turn Community Services. We support people with intellectual and disabilities. We provide day programs and residential programs and transportation in Utah County. And I was hoping that Marcel would be here.
She's here.
Come on. Yeah.
Is she here? Okay.
Yes, yeah. I'm from Turn 2.
And so Marcel, if she can show her face, is going to be taking my position. We're in the process of making that transition.
Oh. Thank you. Marcel, do you want to go ahead and introduce yourself real quick since we've already kind of led into you?
Yep, I'm Marcel and I'm with Turn. Yeah. So I don't know what else I need to say. So
okay, thank you.
She has gone through the application process with UTA as well as with UDOT. So she's got some good experience behind her already.
Great. We're excited to have you join us. We're sad to see Phil go, but welcome.
Thank you.
Yeah, you'll
Jerry.
get over
it. Sorry. I'm Jerry Osler. I am the Grants Compliance Officer at UTA.
And Ashley at Susie's. Oh, you're on mute, hon.
Okay, my name's Ashley. I work from home, so I don't really actually have to look pretty for meetings, but Krista's forcing us. I work for Susie's Senior Companionship Services. I'm the operations manager. We serve seniors, people with disabilities, and we primarily serve people who are on New Choice Waiver or on county programs. And we help with transportation and in-home services.
Thank you. Kara.
Hi, I'm Kara with Utah County Senior Volunteers. We have the foster grandparent and senior companion programs. Foster grandparents is in Utah County, senior companions is in Utah and Wasatch County.
Thank you. Emily.
Hi, I'm Emily Henry. I'm the 211 director at United Way of Utah County. Just 211 information referral line. We definitely refer to a lot of you guys when people call. So glad to be here.
Thank you. Anna. Let's see. I think
I
you're
can't
on.
hear Anna.
Yeah, I was going to say, I think she's on mute.
It doesn't show she's muted, but I can't hear any.
Can you hear me now?
Yes.
Yeah. Perfect. Okay. My name is Anna Stopper. I am with the Payson City Senior Citizens. So I focus on primarily seniors and helping them get to and from their homes to our center. And then we also go on outings. We also do serve some of those with disabilities as well. If you can hear, my daughter's also in the background playing. So she's our youngest senior, but she doesn't get to ride our van, unfortunately. But yeah, so that's us here at Payson City.
Thank you. Fallon.
I'm Fallon Bingham, and I'm also with Turn Community Services. So I work with Phil and Marcel as I help with grants.
Great. Okay, let's see. Richard, do you want to introduce yourself?
Yeah, I'm Richard Morey. I'm with the Grandkids Services. We, like Susie's, we do non-medical care and transport for seniors in Utah County. I mean, we do the whole state, but this is the Utah County meeting, so that's why we're here. But yeah, that's us.
Great. Welcome. Kendall.
All right, yeah, Kendall Willardson, Transportation Planner with the Mountain Land Association of Governments, also MAG. I primarily, in our department, we do a lot of the long range transportation planning for a variety of different transportation projects. Also at MAG, there's a lot there. We have aging services that do a lot with Meals on Wheels and referrals and such. So happy to be here.
Great. Thank you. Erica.
Hi, can you guys hear me?
Yes.
Awesome. Erica from UTA Travel Training. We train individuals how to use public transportation fixed routes.
Thank you for being here.
Yeah.
Okay, we had anybody else join? Are we good? I think we're good. All right. Thank you everyone for taking time out of your day to be here. We're a small group and we've set aside a significant portion of the meeting to address grant application stuff. So there's a good chance we'll finish early if there's not a lot of questions related to that. Let's see. I am going to start with a safety message, and I apologize to those that have heard this already, but when we talk about safety and transportation, we often think about the basics. Seatbelts being fastened, vehicles maintained, defensive driving, accessible securements properly in place. And those things absolutely matter. They protect lives in a very real and immediate way. But in our work, especially serving individuals with disabilities, veterans, and aging adults, safety goes far beyond what happens inside the vehicle. Safety is making sure someone isn't stranded after a medical appointment. Safety is confirming that a veteran gets the necessary mental health services they require. Safety is ensuring an aging adult doesn't have to choose between picking up a prescription and being able to get groceries. Safety is clear communication, reliable referrals, and partnerships that actually follow through. Every single organization that's here today contributes to safety in ways that aren't always visible. Case managers who check in regularly, volunteer drivers who wait until someone is safely inside, dispatchers who make that extra phone call, providers who recognize when something feels off and they act on it. For many of the people we serve, safety isn't just physical, it's emotional, financial, and social. It's dignity, it's independence, and it's knowing that someone is paying attention. So as we continue our mobility efforts, I invite each of us to ask ourselves, are our processes trauma-informed? Are we reducing barriers or unintentionally creating them? Are we communicating in ways that promote clarity and prevent confusion? Transportation may be the vehicle, but partnership is our safety net. And I just want to thank each of you, and we as a department want to thank each of you for everything you do on a day-to-day basis for the populations we serve, especially as funding's sources are going away or changing. You guys work tirelessly to find solutions and to be able to meet the needs of those clients that you serve. So we just want you to know that we recognize all of your hard work and appreciate all that you do. An update on our referral line. With our temporary trips program, we've been actively tracking our data since July 1st. We created a CRM and an app here internally where we're able to keep track of everything. So far we have 180 individuals that have called into the referral line. Of those 180, we've been able to approve 81 for temporary trips. We have an additional 38 individuals whose applications are in progress. Another 19 who have started the process, but we haven't been able to complete it yet for any number of reasons. And we've only had to deny one person as ineligible. And that was simply because they didn't meet the age requirement, being a veteran or having a disability. As of February 5th, we've been able to authorize 1,859 trips. 543 of those have been submitted and paid or paid. And that's just through the end of December. I received 2 more invoices today, so I imagine that number is going to go up significantly. And then for those of you who are helping to provide the trips, but also referring, in the beginning, we were not putting an expiration date on the trips, but we have since started to do that. The typical window is usually 30, maybe 45 days. If there's an extenuating circumstance, I may extend it out beyond that, but just so that you know, when you're telling people about it, do let them know that they're not unlimited. It is a temporary solution and that there is a time frame for those trips. And then I'm going to just cover some of Christy's stuff until she's able to join us, but update on vehicles. There is not a lot to report other than we have 2 sedans that we need to deliver to a partner up in Weber Davis County. And then we will have been able to deliver all vehicles that have been ordered and requested through grants funds as of this moment in time. So that's a first in our history, especially those of you that were around during COVID know how long that took to get those vehicles. So we're pretty excited to be able to be caught up and current on that. And we anticipate moving forward that we'll be able to get most vehicles in a fairly quick time frame, and you won't have to be waiting several years to receive those. We also wanted to mention if you have any issues with your vehicles, especially if they're still under warranty. So that could be, maybe it was in an accident, if your lift is broken or not working, or like I said, something that's a warranty repair or concern, please reach out to Christy or someone in our department so that we can help facilitate getting those repairs. You don't want to reach out to like other departments here at UTA. They won't know the situation or what you're talking about or even how to help you find a warranty. So if you can reach out to us directly, we will help you get those resolved. Especially if they're the newer vehicles. If they're older, there may be things that you still have to pay for, but we can still help facilitate and make sure that that gets done the proper way. Okay, I am going to let Alika take over and talk about the grant timeline and where we're at with some things with that and answer any questions that you have.
All right, thank you. Just updates about the application. The budget form I learned had the indirect cost section still, so I removed that and uploaded a new form. If you already filled out the other one, that's totally fine. The staffing table, some people are having issues with the staffing table. The boxes kind of moved or shifted So if you hover your mouse over it, you'll see that the box doesn't align with the heading. That's fine. You can just put the information wherever it will fit. So if you're trying to fit an email and it's not working, just go to the next box on the right. Or you can also upload a Excel document with your staffing information if that's easier. And then also the summary tab I discovered was linked to the pre-application. I thought that you could edit your summary tab with your main application, but you couldn't. So what I did was I went in and unlocked all of the pre-applications. So now you should be able to edit under your summary tab, your total amount. I can show you what that looks like really quick. 1 second. I'll just pull that up really quick. Okay, can you see my Zoom Grants screen? Okay, so this should be what you see when you open your application. And it should start you in the summary tab. So your amount requested here is the total federal amount. And then the total here is your total project cost. And those amounts should line up with your project budget in the full application. So your total federal down here and your total budget here. Wait, why does mine not match? Does it? Yeah, it does. Okay. So make sure those match. And yeah, that's all. So you don't have to worry about your pre-application. If you said some numbers and then you changed them in the full application, that's fine. But just make sure your project budget is correct. Set up with your local match and then your items that you're applying for. And then they match the summary tab so that your total requested amount is correct. Okay, now can you see my slideshows or is it still stuck on the Zoom grant screen?
It's your slides. You're good.
Okay, awesome. A reminder that applications are due Sunday night at midnight. So if you need the weekend to finish, you can. Hopefully you don't have to. Pre-applications have all been reviewed and you should have received an approval or rejection, and you can now edit the full application. Next week, I'll start reviewing the applications and I will reach out to you if there are any missing items or mistakes so that you have a chance to fix it before scoring begins. I do not work tomorrow, but I will try to answer emails. It's typically hard for me to answer the phone on Fridays, but if you send me an email, I will try to keep my eye on that through the weekend in case there are any application emergencies. But if you're having an issue with Zoom Grants itself, you can reach out to zoomgrants.com or questions@zoomgrants.com. And then also within the application up here on the right is a help button. And there you can contact Zoom Grants here to get a hold of them. Okay. And these are the same dates as last time. So I just pulled them up again so you can see just a reminder that we will start scoring and ranking. And then our next LCCs, we will do review and award. I'm going to skip ahead. Actually, I'll come back, Jerry, and let you do that. I'm going to discuss GMAT first, since we're talking about the April LCCs. So your UZA is a little bit unique in that a long time ago, you all decided to discuss final awards and ranking as a group rather than having a volunteer GMAT, which is like In a faraway place, yes, which is like a group of people that are non-biased, that aren't applying in this application, but that know the needs of your community, and they see the final scores and sit with me and look at my suggested awards, and then they can ask questions or raise concerns about those awards. But as risk assessments are now required and include sensitive organizational information, I was thinking that maybe we should discuss the possibility of you having a GMAT down here, because back when you decided to do it as a group, risk assessments were not included in application scoring. And so I just thought that was something to bring up to reduce potential conflicts, or, you know, protect partner relationships if anyone feels weird about discussing the risk of their agency in front of a group of their peers. You know, that could be a little bit uncomfortable, maybe. So I wanted to bring that to you and see if you guys are open to changing to the GMAT process, the same as how the Ogden and Salt Lake UZAs do it, or if you want to keep it as a group and everyone can see the scores and the risk assessments and everything, and you still discuss awards as a group and decide that way, then that's fine also. Does anyone have anything to say? Comments, questions? I need someone to have an opinion.
Is anyone opposed to switching to a GMAT?
What's that?
I'm just trying to remember from a long time ago of, I know, because we were a pretty small group.
Yeah, it was a small
And
group.
so it was pretty small group, so it really worked not that well. And like you said, we didn't do the risk assessments back when. So I know the dynamics have changed a little bit. So I'm not real familiar well with the other process. So but I don't know. I don't know what other people think or what their thoughts are on it, but if
Typically how
it
the
seems
other
to work,
UZA
it seems to work okay.
Yeah, typically how the other UZAs do it is someone from their MPO is on the GMAT, and then any agencies that are part of the LCCs but are not applying in that UZA's application so that it's not biased, they can volunteer also. And then we usually have someone from UTA that didn't score applications help as well. So this year that would be Glenda, who used to be our compliance officer. So she's on the GMAT for all UZAs this year, because we always pick someone from UTA also, just so we have more people. So I'd say, oh, and then Alyssa from Bragg always does all three for us as well. So
seems to me like that would be a better way of doing it going forward. This is Phil Shumway with Turn.
Okay. All right. Well, if anyone has concerns, you can email me offline. But I'm gonna go ahead and say I don't hear any big no votes. So let's say that in April we're gonna do the GMAT for Provo Orem and see how that goes this year. If you guys like that. Kendall, if you are willing to be on the GMAT for this UZA, that would also be really helpful, as you are the MPO down here. Would that be okay?
Yeah, no, just we can coordinate offline too, just to get a refresher on that. But yeah.
Okay, awesome. Thank you so much.
Yeah.
Okay. And so if anyone is not, oops, I did the wrong click. If anyone is not applying in this UZA but wants to volunteer on the GMAT, also send me an email and I will let you know how that works. Okay, Jerry is going to talk about lunch and learns and site visits.
Okay, so for lunch and learns, as of right now, I've come up with 3. One being how to use Microsoft Office to create QR codes. So I just recently worked on this with BarrelCare, where you can make a QR code that you can use for lots of different things, but specifically you're doing pre and post trips and putting them on the vehicles. So as people get on and off, they can scan the QR code, fill out the form, and it'll automate into an Excel sheet. So it tracks everything for you. And then when we need access to that, it's super easy to send it over. Another one on vehicles 101, that one just going over the entire vehicle delivery process with you guys, start to finish, from the point of getting approved for a vehicle, the ordering of a vehicle, delivery, match, photos, what you need to upload on Ride Pilot, what you do when you crash a car, what you do when there's an insurance claim, all those things. So just a complete vehicle 101. And then a social media 101 to make sure that you guys have an understanding for how to utilize your social media so the community is aware of the services that you provide and the work that you're doing, and they can see everything and hopefully reach out to more people that could use your services. If there's any other topic ideas or things that you guys would like, please let us know. We're willing to do more or less anything.
Oh, and just a reminder that the post-award training is usually in September, so we won't do a lunch and learn then. But yeah, if you have any other ideas, let us know.
And then for site visits, 2025 is getting wrapped up. Everybody that has not already gotten the results for their site visit that had one scheduled for 2025, those will be done by early to mid-April. Alika, you can see your calendar. Yeah.
Sorry.
So then right out of those, we're going to move into scheduling in April and May for 2026 site visits. And we're going to begin those site visits in September through early October, wrapping them up before 2027. So for a couple of you, you'll have to bear with me because you'll be doing 2 site visits really close together for those 2025 and 2026 years. It's only going to happen once, so we get things on track to a point where we're only doing the represented year within the year. So 2027, all 2027 site visits will be conducted, finished in 2027. They won't roll over into the new year like these ones have. Don't worry about reaching out to me about your site visit scheduling or finding out if you have one for 2026. I will be reaching out to you guys in the coming months. And then with that being said, for everyone that did have a site visit in 2025, I appreciate your guys' compliance. It was super nice to meet all of you guys, get to see what you do, see your facilities. You're all amazing. I look forward to going into the 2026 site visits. But overall, just thank you guys for being so compliant and getting me what I needed in such a timely matter.
Thank you, Jerry. Does anybody?
Sorry, I should leave the email up for a second.
Okay. I was just going to ask if there are any questions related to applications or things you're stuck on in this moment, especially since Alika's out tomorrow. If you have any questions, now would be a really good time to address them with her so that we can make sure those are taken care of so you can finish your application by the deadline. Okay.
Do we have to?
Go ahead.
Do we have to include that inventory sheet on our vehicles?
In your application?
Mm-hmm.
Yes, if you have a fleet, then you have to upload your fleet inventory to the documents section. You don't have to fill out the table though, unless you're doing a replacement vehicle. And there is a template.
If we just have a couple of vehicles, 2 or 3 vehicles, is that a fleet? Or
you have to put your entire fleet, even not just 5310.
Okay.
but you have to
And then-
specify which ones are 5310.
And the
on fee.
usage of life, what do you put in that area?
For the 53, typically it's 4 years or 100,000 miles.
Okay.
Unless you have a big old bus. I don't think, I think they're all 4 years right now.
Okay.
Any other questions? Okay. Let's see. Has Christy joined us yet?
I haven't seen her.
Okay.
I'm here.
Oh, okay. Okay.
Sorry, I just barely got on. Just
Okay.
barely.
No worries. We just
That's good.
finishing up with Alka's 5310 stuff. So,
Okay.
real quickly, for those of you that I have emailed and reached out to ask for updates about your organization for the Human Service Transportation Plan, if you have not gotten me that information, if you can get that to me by next Friday. I don't want you to worry about it this week with your applications, but if you can get it to me next Friday, we're trying to get those plans wrapped up. There may be a few of you that were not listed in the old plan, and so I may still be reaching out to you for a brief summary about your agency, number of people you serve, maybe the number of trips you provide, rough estimate of how much you spend on transportation, things like that. And then I am going to let Christy take over to lead our temporary trips discussion.
Oh, I had my mic on. Hi, everybody. Sorry, I'm late. We have what we call a triennial review coming, and I've been working with the contractor because all of our documents are due tomorrow. So sorry about that, but unfortunately so if it makes you feel any better, the triennial review is like our site visit. So I've been trying to get help get things together and stuff for our site visit from the federal government. So I appreciate your understanding. Our meeting went long. I was only supposed to meet a half an hour with the contractor, and we met an hour and a half. So that tells you where we're at. Anyway, I hope you guys are all having a good day. Trista, did you mention that they should contact me if they have repairs on their vehicles they need to do?
Yep, I took care of all that vehicle portion for you.
Cool.
Yep.
And she probably told you to. Anyway, vehicles seem to be coming in much more timely, and the only ones that we get directly manufactured are the ADA Transits. Otherwise, the rest we can buy off state contracts, and typically we can get those fairly quickly. So our turnaround on those purchases, if you put in a request for vehicles, it's getting quicker. Thank heavens. So, okay, on the temporary trips. I just wanted to ask a few questions. I'm trying to find out sort of what's going on and best uses, how we can help, those kinds of things. I don't know how many of you are involved when the legislature is in session. I know some of you go up there because you're watching bills for your own organizations or bills that might affect the people that you serve. So that being said, all the departments, everything in the state was asked to turn in a cutback budget, basically. And Medicaid, transportation, and DSPD funds were originally on cut off at the appropriations list, but I just want everybody to know I have been told by our government relations director that the Medicaid, transportation funds, and DSPD reimbursement has all been returned and made whole back onto the budget list. So they will get their appropriations like they're supposed to. So thank heavens for that. Because that could have impacted things we wanted to do a lot. That being said, so with the temporary trips, there's a couple things. One is when I say we, UTA, our little department here, we're putting in a grant, a very small 5310 request, but we do not know if FTA will approve it. Oh, that's okay. Anyway, we're looking to, and it would be run through Trista as mobility management. We would use numbers for a study. We would study this and see how much money it saves and some things so we could report back, say to the Ledge or FTA or whoever. We're looking at doing like a grocery delivery, annual membership. So say for instance to, Walmart Plus, so seniors and persons with disabilities could just order online if they are able to do that and then have their groceries delivered, or if they have a caregiver that could help them, or somebody that works at one of your agencies that could help them with those orders. And the reason we're looking at that, in fact, I think Trista got numbers from John, right? The numbers that we've sort of been touting.
Yes.
It can be a lot of, one, it can be a lot of trips, and two, it can be a lot of money that we're spending to get people to grocery trips. And it's not that food is important, obviously it is. So that's why we've been funding those trips. But if we could free up some of those trips and funds for medical trips, since that's typically our top priority, we would like to do that. So that, because we do see this as a somewhat of a solution. I am hopeful that we can get the medical industry more to the table in the coming year or two to help be responsible for some of this transportation. It's, when people don't get to their medical trips, that it's their money they're losing. Yet medical is very reluctant to ever get involved in transportation of their own customers and people coming for appointments, which I find ironic. So, we're always responsible, right? Us and our organizations and our teams are always doing this. And it would be interesting to statistic, would it not, to turn into the legislature and say, would you like to see how many of these trips are for medical? Just for medical, because I bet the majority of all of your trips are for medical, unless you're bringing people to a day program. That being said, so I know that there is a quality of life issue that sometimes, going to the store might be the only time somebody gets out of their home and this and that. And we can look at it as on a case by case basis. In other words, maybe we will give them an in-person trip maybe every other week. And then if they need groceries in between, they can order them in or something like that. Because we certainly want people to have their quality of life, but it's a lot of money. According to the numbers we got, and John, you can correct me if I'm wrong. Trista, what were the numbers you got from John?
So the case we used was an individual through Utah Valley Rides who had been given 134 trips to the grocery store in a calendar year, at an average of $55 per trip, which is what we're paying right now for most trips. That equated to about $7,200 in a year for one person. So if we're able to free up even half of that for rides, that's significant. If somebody goes to the grocery store once a week, even, that's 104 trips a year. And that's around $5,000 that we're freeing up for other purposes. So, and maybe by freeing it up, it frees it up for medical appointments, but maybe it allows us to give other quality of life trips that we currently aren't giving, to get to a family member's house, to get to the hair salon, some of those things that might be important to that person, but they're not able to do either. So there's lots of potential there for it to free up opportunities.
So that's the thought behind the, food delivery service. We are leaning towards Walmart mostly because most of our customers are very familiar with what they have. They have food, they have all the other household supplies and things they might want, including clothes or whatever. So we thought that would probably be the easiest and inexpensive, most familiar for people. And Walmart's very good about doing like partnerships, so we might be able to get a reduction in the cost for those memberships as well. So we're sort of leaning that way. We wouldn't it's such a minimal amount of money. We don't have to put out an RFP for this. We don't have to do a bidding for this. So we'll certainly investigate, but that's sort of the way. We're sort of leaning that way at this point in time. That being said, so I would like to know, and I am sorry because some of you, I don't know what you're from, but I might call on you anyway. Marcel, you're new. Who are you with, Marcel?
Sorry, I had to turn on my mic. I'm with Turn.
Oh, you're with Turn too?
Yes.
Okay, awesome.
Yeah.
Okay. Do you work?
She's Phil's replacement that we met earlier today.
Yeah.
Oh,
Yeah.
nice. Okay, awesome. Okay. We can now, maybe or somebody can help you out, which is what challenges is Turn seeing transportation wise, funding, that kind of thing?
I'll have Phil answer that.
Bill, what are we seeing in Turn? That's our challenges.
Well, our overall challenge is adequate funds and staffing. This has been a year where it's been very hard for us to fill the vacancies of our employees.
Mm-hmm.
And our third-party contracts have been so helpful to us because that's really been able to give us the time that we can focus on staffing the times when people are in service, because being able to use the third-party contracts have really helped us in meeting the need of getting people to the center and getting
Awesome.
people out to activities in the community.
That's awesome. That's great. On the staffing issues, I'm just going to be really straightforward because this is my impression from being on the state aging board and some things. I'm suspecting it's probably a pay issue, and that's because, again, you have limited funds.
Yes, it is. In fact, we participated in a statewide survey this year with an outside contract for human services.
Okay.
And what the findings was is that we're about 26% down in our rates, and of course the starting wage for the people we support. I've always been an advocate that it's a $16-17 starting wage is not enough to have people with the skills that we need to take care of such vulnerable people in the community.
Absolutely. That's one of the issues I've seen probably the whole time I've been in this job anyway, and serving on the aging board too, right? When we're looking at CNAs or people in assisted living, right? We do not, we have all these requirements, but yet they, like you say, they don't want to pay for what that job is really worth, quote unquote. And it makes it so it's hard to compete, right? To compete with private sector or other things, because people do want to get paid. I mean, everybody's got bills to pay.
And we have not really actually seen a rate increase in almost 4 years in all of our funding, and that is really telling right now as far as because we have high expectations of our employees, and we require them to have a lot of skills and training. And we really see that not only are our rates low, but our starting rate, as well as the rates for people that have worked for us for a number of years, does not compete in the private industry at all.
Right. Well, thank you for that feedback, because that's good to know. I'm just sort of collecting, like I say, I want to hear where our shortcomings are and maybe where we can help with some things. I mean, we will be asking for, when I say we, again, that's UTA Coordinated Mobility, because we have been handling the temporary trip funds, and Trista's been doing all the mobility management for that program. So we just keep loading more work on her. So anyway, so at this point, ideally moving forward, we would like to do some after hours transportation, weekend transportation. We have, quite a few, especially down in Utah County, is out of 3/4 mile. We have a lot of people that don't even live close to a bus stop, a train stop, anything like that. Also, like I say, and if they're out of sight of 3/4 mile, even if they have their paratransit eligible, they can't use the service, or they have to get into the service area again, which is a difficult thing. So, and then of course, paratransit follows what the schedules are that UTA has for fixed route. And when we don't have much, evening service, weekend service, those might be areas we could expand a bit into with the temporary trips pilot. We're keeping a lot of data. So moving so that we can show sort of proof of concept and some different things, and also maybe get more permanent funding for everybody and that kind of stuff. So just know we are looking to do that. We look at things on a case by case basis. Again, this is mostly, we can do this because it's a pilot. Trista could tell you all kinds of interesting one-off cases that have called into her and situations she's had to evaluate. So unfortunately, right now, temporary trips is temporary. This is not a permanent solution for people, but temporary trips can, like, we will do things like if somebody, again, they have no other access, say, for instance, to get that to dialysis. Well, then we may fund all their dialysis trips through temporary trips. Now, we won't fund a bunch of other stuff, but we would fund their dialysis trips because, right, they need to get there. And
Christy,
yeah, go ahead.
I just wanted to jump in and share an actual scenario real quick that was really impactful for me because I received a follow-up email from the gentleman. He required 5-day-a-week treatment in a hyperbariatric chamber, and his wife had to travel for work for 1 month. And so I went ahead and approved all of those trips. And he sent me an email the other day and said, I'm alive today because of these trips, because I wouldn't have been able to get to my treatments, and I'm in remission. So thank you for this program. So that's the kind of impact that this has. So it's just, anyway, I just wanted to share that particular story because I got the email thanking me today from him.
Oh, that's good. Yeah, we need to save that, and we need to save that and make sure that the organization knows about that and some things too. But I mean, you guys experience those kinds of things all the time, I'm sure, with the clientele and the people that you serve. And so, we worry about these people as well. We feel we're at the same level of ownership, at least we feel like. We're not as hands-on as you guys, but we certainly feel that obligation and that ownership of, we want people to get to what they need, right? I mean, and if they need to get to medical, if they need to get some food, again, we got to make sure that these things are happening for our most vulnerable people in our society. So thank you for sharing that, Trista. I used to, when I did vouchers, when I started this back in Trista's position many years ago, I used to get notes every once in a while from people when they'd send the vouchers in, telling me how grateful they were for the voucher program and how much it had helped them. I mean, so we know that, right, this is real people and this is real lives. So we should tell you all that to say, don't assume if there's an odd situation and you have a question, or it's somebody that just has an extraordinary situation, reach out to Trista, because this is a pilot and we may be able, again, to help the person out. So please remember that. But we are going to, like I say, but if so we're trying some different things. We're going to get more funding is what I'm trying to tell you. Trista is screening all the calls. She'll make the qualifications for the food subscriptions if we get them from the grant. If we don't get them from the grant, I'm going to bark up a different tree for some funding for that, hopefully. So I think one way or the other, we will be able to probably implement that. It doesn't, like I say, it doesn't take a lot of money. So thank you. She is. So that being said, we are going to, what else did I have to tell you on all of this? I forgot to mention in the last meeting, I apologize. I have notes all over the place. Again, it's been a little bit of a chaotic week, so I apologize. Rural Medicaid funds, I want to make sure you guys know, because your county touches, and sometimes you go into rural areas. And so what's going on is, traditional Medicaid funds have been cut to a certain level. It's really affecting Department of Health and Human Services. However, in the big, beautiful bill back last summer, there was money put in there for rural health to sort of try to make up for some of those cuts in Medicaid. that means, so we have a lot of money. So every state's getting money, every single state in the union. It's lots, it's millions, it's hundreds of millions of dollars for our state for rural Medicaid. But this is only a 5-year program. It's a 5-year funding cycle for these funds. So we're right now in funding year 1, and the federal government wants the money spent very quickly. So the funds that they're currently using will need to be spent out by fall, and then the next round of funding will come. Transportation in rural areas for medical appointments is being looked at and considered, and we're working with the HHS right now to try to see some things we could implement. That might be things like e-voucher to, get people from rural areas into populated areas, say like Richfield or something like that. But now, we have technically our friends in Payson are in the rural area. It could be getting someone from Payson over to, right, medical at the hospital in Provo. I mean, so this can help some of your clients, I think, and people that you serve, even though technically we deal with the urbanized area. And we'll be doing a lot of this if awarded and for this transportation, it would probably be handled through IRSTA. Most of you are aware of IRSTA, which is our statewide transportation association. And so that way it can go, we can help the rural, but then we can get proof of concept, I think, from rural to help fund some things in the future for the urbanized, if that's a possibility. So it's hopeful. So I just want you to be aware of that. We might be able to tap into some of you for some help that you would get funded for doing transportation in those areas. Like I say, since I know some of you dabble in that already due to your location. So I just wanted to make sure I let you know about that, and I will keep you updated on that. And then next, segueing in, if you recall, I told you all about we've been trying to keep you in the loop on the SB 195 study. A lot of you were at the first stakeholder meeting. So there is another one coming. Let me set it my way so I can see everybody. So there is one, it's going to be on Monday, March 16th at 10 a.m. If you have not received an invitation to that, please let me know in the chat and I will forward the invite to you. Probably a lot of you received this because a lot of you received the last one. So if you're not aware what this study is, last year during the legislative session, Senator Harper sponsored a bill. It's called SB 195. And in that bill, he asked for a study to be done with UTA and UDOT to let's improve the coordination and delivery of human service transportation, to see about if there are ways we could consolidate some of our work and services. So that's what the study is. And then the meeting this next time, the agenda is project update and work completed to date. So the contractor will report all the work that they've done so far, data collection and findings, gaps and needs summaries. And I think they've reached out a little on this, but we really encourage them to use a lot of our past studies and our LCC plans like Trista's working on and stuff, because a lot of that remains the same. And we sort of went through gaps, at least you guys, we went through all our gaps this last year and some things. So we wanted them to be able to use the funds on things they didn't know, I guess is what I'm trying to say. And part of the request was that they use information from standing studies, not just ours, ones from the MPOs and things like that also. And then they're going to have a service consolidation roundtable. And I think what that is, they're going to present possible scenarios and possible things that might be able to be consolidated and get your feedback on what you see as the barriers, or if you think that could be accomplished. So I would encourage you to be there if you can. And again, if you did not receive an invite and want to attend, please let me know, either email, put in the chat, something, and I will forward this invite to you. And then that being said, that segues me into one thing that we've been looking at. And again, this involves our friends at IRSTA a bit. Sometimes it's just better to work with IRSTA because it takes UTA out of it, if that makes sense. It's easier because that's a nonprofit entity and it serves everybody, all of us throughout the state. So that being said, I've been looking at a company called Insurica. Is an insurance provider. They will do, they help organizations like ours combine their insurance and liability, supposedly at a lower cost. It would also allow us each to use, like, be able to share vehicles and share clients in different vehicles and whatnot, which has been a barrier. Anybody who's been on these for a while understands that that's been a huge barrier. And we know that the costs are very high on the insurance you carry. So I am trying to help get a solution. Insurica is going to present to the URSTA board. We'll have an URSTA board meeting here in the spring. They are going to present to us about what they could do so that we could, if it's a viable option, we could offer to not only the urbanized areas, but to the rural areas as well. And so I'll keep you updated on that, but let's keep our fingers crossed. I also received an email from Susie's insurance person that she uses, because he's also been looking to see if there's some options. So I will keep you updated, but we are working on that. And again, that just segues us back to URSTA. So I will turn it back over. I think I got everything this time. I'll turn it back over to Tristan.
Thank you, Christy. I know several of you have attended the URSTA conference in the past. In fact, probably most of you, but if you haven't, registration is open. It's going to be in September, the 22nd to the 25th in Price. I believe we're going to follow the same format this year that we did last year, where we'll have the rodeo in the middle of the conference rather than on Saturday morning. And then we will have the big night out and awards banquet for the winners on Friday evening. The committee is still working out what the big night out is going to be. I know they are, because we're in a bit of a rural area, they're wanting to find something that will be enjoyable and fun for everyone. When we were in Kanab a few years ago, we did the slot canyons, and that was probably one of my favorite things I've ever done. So I'm sure we'll be able to see some beautiful parts of the state and do something enjoyable. So there are, like I said, the registration is open. There are scholarships available through URSTA, but the qualifications on that are kind of changing or up in the air. We're not sure what areas will be approved for scholarships and what ones will not. But please, if you think you qualify, you can fill out the scholarship application, and Stacy will let you know if it's approved or not. Additionally, if you do send employees and drivers and you've applied for operations reimbursements with the grant, that is considered an operations expense. So you could be reimbursed for at least 50% of those costs for sending your folks to that. So that's another option. Do we have any questions at this point before we talk about our next meeting and what that's going to look like? I don't see any hands up. So, okay. So our next LCC meeting, because of it being an award year and because we will be having each of you present about your projects, we have moved. I sent out an email a while back asking if there's anyone that it would be an issue for. We have moved the April meeting to Tuesday, April 21st. It will be held at the Turn Administrative Offices there in Provo, like we have been having it, and it will be from 10 to roughly 1. It may be less than that. That was based on us having you guys as a team review the applications rather than having a GMAT. So it will most likely be 10 to noon. And then those who are part of the GMAT will need to stay beyond that to review the applications and make awards at that point in time. We are a small group, so I imagine it won't take more than, 5 or 6 minutes to present on your project and answer any questions the GMAT has. So anyway, is there anything I'm forgetting, Alika or Christy, on that?
I don't think so.
Okay. So again, that will be Tuesday, April 21st from 10 to most likely noon for you. And then if you're on the GMAT, beyond that. So I will send out a calendar invite this next week to everyone so you can get that on your calendars. And again, it will be held at Turn's administrative offices there in Provo.
And I forgot, but I should have told this to the others. We'll bring some snacks. I won't bring a whole meal, but we'll bring some snacks. I don't want people to, blood sugar to drop. Trying to figure out our awards.
Thank you, Christy. Okay, thanks again, everybody. If there's no questions or anything else, we'll finish up a bit early today. Let you get back to whatever you've been working on. So we appreciate you all. Have a good one.
Thanks, Trista. See you guys.
Thank
See
you.
ya.
Thank you.
Thank you.